Hi, my name is Jaz Gulati and I am a general dental practitioner practicing in London and Oxford. I am a self-confessed dental geek, and what I want to talk to you about today is one of my passions, which is occlusion, tooth wear and splints. I talk about a lot in my podcast, which I run and it's listened to by dentists all over the world. It's the Protrusive Dental Podcast, so do give it a listen if you can. What I want to talk to you about is anterior midpoint stop appliances, just in a couple of minutes, and in particular I want to talk about something called the FOS appliance, which is the Flexi Orthotic Splint. I want to tell you why I like this specific appliance compared to other AMPSs, let's call them, because of a couple of advantages this has. Now, I'm not one of those dentists who give every single patient one type of splint. I don't prescribe all my patients a Michigan. I don't give all my patients a soft bite raising appliance. Each patient gets a diagnosis and thereby the correct appliance for that diagnosis. And for a lot of my patients, I'll be giving anterior midpoint stop appliances for deprogramming or acute pain. And what I want to talk about is some of the advantages that this FOS appliance has. It's made out of a polyester copolymer, and with that I can actually bond any methacrylate inside there, and actually they'll become one. The bond is very reliable, unlike other splints whereby the lining material and the splint itself, they sort of peel apart or come away. I don't have that problem with this FOS appliance. Also, because of the fact that it's bonded reliably together, it doesn't stain as much, and because there's no leakage in between the layers, and it actually looks fresh. It doesn't smell and doesn't look discolored as much as other splints usually would do. Also, because of the fact that it becomes almost monolithic, it's actually really strong, and that's a big plus point. Another benefit of the FOS is that I can actually get correct axial loading of the lower incisors when I'm using a maxillary floss. They also have a mandibular one, but when prescribing any AMSA, you want the force or the occlusion to be going through the long axis of the opposing teeth. This helps to achieve that quite easily because of the angle that's purposely been beveled into it. So that's another plus point of the FOS. I'm not going to get into the sort of controversies of using AMPSs, and where some dentists are very passionate about using them, some are passionate about not using them. So we're not going to get into that. If you're already using an AMPSa, or if you want to start using AMPSs in your practice, then FOS is really good for that aspect as well. It's not something that's used very much in the UK at the moment. It's used more in Switzerland and other European countries, but I think there's a great benefit of the FOS appliance in that you can bond the methacrylate inside it. Another cool tip I can give you is when I prescribe a FOS appliance, I always colour the occluding surface in a black Sharpie pen. Now, thank you Michael Melkers for teaching me this. The patients go home and they will obviously brux and grind their teeth and do funny things with their teeth, and they'll form a pattern on my splint, and when they bring it back and we can observe together, it's usually a laterotrusive sort of pattern that you see, and I can actually show them, and they see it. They're not stupid. They see themselves that actually they are grinding their teeth after all, despite what they tell you, and the evidence is clear. It also helps me to plan future restorations because it helps to show me exactly to what degree they're parafunctioning. I've got some patients who actually significantly notch into the appliance, and there's cool little things that you can do to actually repair it using the methacrylate. So the FOS appliance is a great AMPSa that I use, and if you want to learn more about AMPSs, I've got a couple of episodes out there on my podcast to listen to, but if you're using AMPSs at the moment and you're looking to try something a bit different with perhaps better longevity, then consider using the FOS appliance.